Hi, my name is Julisa Miranda and this is my oral exam. Gaucher disease is an inherited condition which causes a mutation in the GBA gene, which codes for an enzyme called glucocerebrosidase. And what this enzyme does is that it breaks down glucocerebroside, which is a glycolipid, and it is formed by sugars and fats. And when they have the mutation, there is an accumulation of these glucocerebroside. Enzyme replacement therapy is one of the most common treatments for this disease, and what it does is that you replace the defectuous glucocerebrosidase with active enzyme, and that is produced as a recombinant protein in other organisms. These enzymes can be imiglucerase, teliglucerase alpha, or velaglucerase alpha. After the transplant of the enzyme is done, the concentration of glucocerebrosidase will come down in the liver, in the spleen, in the bone marrow, and other organs, and this will cause a reduction of the symptoms presented by the person. Substrate reduction therapy is another option, and this targets the biosynthetic cycle of glucocerebroside. Miglustat, which is a D-glucose analog, inhibits the GLC synthase, so glucocerebroside is no longer produced, and this causes the reduction of influx to the lysosomes, so it reduces the glucocerebrosidase activity. Pharmacological chaperone therapy works by the administration of sub-inhibitory concentrations of chaperone, pharmacological chaperone. Instead of focusing on reducing the influx of glucocerebrosidase to the lysosomes like in SRT, this therapy wants to restore the functionality of the endogenous enzyme. So the substrate concentration goes down because of the mending of the enzyme. A lot of surgeries can be carried throughout this disease, but the most common ones are to just help reduce the symptoms and the pain. And the most common surgeries are splenectomies, so it's the spleen extirpation, and musculoskeletal surgery. Also, there could be orthopedical surgeries, and bone marrow transplant and blood transfusion are also the main treatments for this. Unfortunately, enzyme replacement therapy can be only used for non-neurological affected types, just type 1. And this happens because of the insufficient permeability between the blood-brain barrier with the macromolecules, so that's why enzymes cannot be used for type 2 or type 3. Also, another disadvantage is the cost of the therapy, because it is $100,000 to $200,000 a year per patient, so it isn't a very accessible therapy, and it would be a lifelong commitment to start this therapy. And I think that the way that we can overcome the disadvantages of the enzyme replacement therapy could be that hospitals do more programs for people with Gaucher disease, so they can be supported economically, so that people can donate and they can be like economically liberated a little bit. And also for the type 2 or 3 therapies, maybe just look for a way to modify the enzyme so that it can reach the brain, but I think those would be the ways to do it.